Is it clear? So those are the different elements. So I'll start by the obstetric conjugate. How do you measure what is the relevance of the obstetric conjugate? Now let us say that this is our pelvis here. So here behind we have the sacral promontory. The sacral promontory goes like this in front. This is the sacrum here. Is it clear? This is the two ilia. Now this, let's say that this is the rami of the pubis is going to come in front here and is going to be connected here in front with the pubic symphysis. Then inferiorly here you have the ischium down here. So let's say that you have this as your pelvis. Now from the sacral promontory, this distance from sacral promontory up to the pubic symphysis, upper part of the pubic symphysis, this diameter is called the obstetric conjugate. Is it clear? Now if you see it from laterally, you're going to have something like this. This is the promontory like this, and this is the pubic symphysis somewhere with the rami here, and then the rami are going to be connected here, and this down. So that distance is going to be from here to here, as you can see here. So if you see from lateral view, the distance from the sacral promontory now up to the pubic symphysis, this distance is going to be still called the obstetric conjugate. Is it clear? Now what is the relevance of this obstetric conjugate? The obstetric conjugate is very important because the biparietal diameter of the child, is going to pass at the level of the obstetric conjugate. So when the child is going to be like this, let's say this is the nose, this is the mouth of the child is going, and this is the neck. Is it clear? The biparietal diameter, the diameter of both parietal area, usually pass at the level of the obstetric conjugate, and the biparietal diameter is the diameter that does not change. Is it clear? It is a constant diameter, and that constant diameter passes at the level of the obstetric conjugate. Is it clear? You need to know that what the anteroposterior diameter of the child, is it clear, is going to change because the child is going to flex. Is it clear? So let's say that this is the head, this is the eye of the child. The anteroposterior diameter, this diameter here of the child, of the head child, is going to change because during the mechanism of labor you are going to have flexion of the head of the child. Is it clear? So it's going to change. That's why we don't usually too much take a delay when you have a cephalic, when you have a vertex presentation, and then the child is having we don't usually take consideration of the anteroposterior diameter when the child is in vertex position because it's going to flex. But now in the case of the biparietal diameter, for the biparietal diameter, even though the child may flex or may extend the neck, there is not going to be any change in the biparietal diameter, and usually the biparietal diameter is going to pass through the obstetric conjugate. That's why it's very important. Similarly, during the mechanism of labor, after passing the obstetric conjugate, the child is going to rotate such as to pass the transverse diameter. So the biparietal diameter is going to pass through the transverse diameter of the maternal pelvic, the mid pelvis. Is it clear? So it's going to pass now through the transverse diameter of the maternal mid pelvis. Is it clear? So those are the different elements that you have to visualize. And then lastly, is going to still rotate such that it's going to pass now through the pelvic outlet. Is it clear? So those are the different elements that you must know in order for you to understand very well perimetry. So now so those are the different elements. So now for perimetry, we started with how to measure the obstetric conjugate, which is a marker of the pelvic brim. Is it clear? So the marker of the pelvic brim is the obstetric conjugate. Is it clear? And now the obstetric conjugate, in order to measure it, you place, let's say that this is the vaginal outlet of the female, with the vagina here, the labia majora, the clitoris here, and here you have the anus. So what happened is that in this case, you put your finger into the introitus of the vagina, and then you try to feel the sacral promontory. Is it clear? You try to feel the sacral promontory. Now when you feel the sacral promontory, you now measure the distance from here which is your index finger, the tip of your index finger, till the position at the level of the vaginal outlet. Is it clear? The vaginal outlet orifice. Is it clear? You measure from the tip of the finger to the vaginal outlet, and that distance is going to be called the diagonal conjugate. Is it clear? The diagonal conjugate that you measure with your hand is going to be equal to the obstetric conjugate minus 2 centimeters. Is it clear? So the diagonal the obstetric conjugate, the obstetric conjugate is equal to the diagonal conjugate minus 2 centimeters. So you measure the diagonal conjugate with your hands, and then you subtract 2 centimeters to it. So let's say that you have measured 12 centimeters. It means that the obstetric conjugate is going to be 10 centimeters because you subtract it minus 2. Are you understanding? So those are the different elements. Now, when you measure your obstetric conjugate, now there is a relevance now of the measurement of the obstetric conjugate. You need to know that what if you have an obstetric conjugate which is less than or equal to 8 centimeters is called you have what is called contracted pelvis. Is it clear? Contracted pelvis. And in case of contracted pelvis, the child is never going to pass through that bony pelvis or pelvic canal. Is it clear? Now, if your obstetric conjugate is between 9 to 11 centimeters, you have what is called a borderline pelvis. You have what is called a borderline pelvis. Is it clear? And in the case of a borderline pelvis, there is going to be passage. There can be passage provided that the child is going to be microsomic. The child is small. Is it clear? And then the last one is when it is greater than 11 centimeters. When you have greater than 11 centimeters, it is now called normal pelvis. Is it clear? Normal pelvis. When you have a